Good evening, folks. I'm with Shea Dobson, who is the mayor here in Ocean Springs. Recently, Mr. Mayor, you hosted a fundraiser for legalization here in Mississippi. Can you tell us a little bit about that?
Well, it wasn't necessarily a fundraiser. It was just a sign gathering event, and it was to support the legalization of medical marijuana. I can't remember the initiative number, but the medical marijuana push for 2020. So it was something that I wanted to do because I've worked a lot of campaigns and a lot of causes, and I know how difficult it is to get signatures. So I just wanted to provide a place where people could come and not only be there to sign, but get information. I wanted it to be for people who maybe even were on the fence about it, or just wanted to have more information to come and be able to talk to me or just representatives from the campaign. Really just to answer any questions and just provide opportunity to for people to get information.
Okay. Are you for legalization or decriminalization, and why?
Well, I mean, I'm definitely supporting the medical legalization.
Okay.
I think that when you start to talk about decriminalizing it doesn't really get to the root of the problem of the black market.
Okay.
I mean, because if something is, when you legalize it, you need to bring it completely out of the black market. You need to bring it into the sunlight.
Right.
Let honest companies, contribute to society. Pay their taxes and so when it's decriminalized, it's kind of like you're saying, well, we don't mind if you do this, but we're going to arrest you if depending on the terms and conditions. It's just, I think it sends mixed signals. So I think you need to either legalize it or don't.
Okay. All right. Have you, as mayor, spoken with city council members or whatever, talked about logistics within your city? What would happen, day one?
I've talked with the aldermen a little bit about it. It's not something that most of them want to really get involved with.
Understood.
I know most elected officials don't want to get involved with it, unfortunately. But no, we haven't really discussed it. But it is something that I've thought about. I think that with medical, it's so, and especially with this initiative, it's controlled by the Department of Health.
Right.
And so there's so many controls already around it that I don't think that it's going to be. I don't think there's going to be a big problem. What you're doing is we're talking about letting soldiers treat their PTSD and cancer patients, get some relief. I don't think that's going to be a problem.
Okay. This comes from one of citizens living in there in Ocean Springs. Mm-hmm. He says, would you allow a dispensary inside of the city limits under contract to collect 7% sales tax and a percentage of sales tax, even if it went against state law?
Well, I mean, you can't violate state law.
Okay.
So we would have to, whatever the state law is, we would have to comply.
Okay.
A big part of what I want to do is try to keep the city out of unnecessary lawsuits, and
yeah.
and so it's one of those is regardless of what we personally feel or what we think should happen, just by doing that, you're gonna hurt the cause more than you would actually help it. So
okay.
I would have to say no.
Okay. All right. I'm going to kind of finish up with a pretty broad question here.
Okay.
Was there a watershed event within your life personally that you were like, okay, well, this needs to happen for us as a society or somewhere personally?
That's an interesting question. Not really. I wouldn't say it was like a eureka moment for me.
Right.
It was just one of those where, just throughout my involvement in politics and just listening to the different sides, I think that one thing that we have to, when we think about it, is I support getting government out of healthcare, getting bureaucrats out of dictating what medicine, how I medicate myself. Republicans spent 8 years talking about how they want to get government out of healthcare because of Obamacare, and now a lot of them want to turn around and dictate to soldiers how they treat themselves after they just went and fought for our freedom. They want to dictate, you can't claim to be pro-family and then support a system where people get thrown in prison because they're trying to medicate themselves, and we're breaking up homes. So I think for me, it was just seeing the systemic, just in the injustices, and it's so, when we're not talking about some substance that's, when you touch it, you die or anything like that. We're talking about a substance that has been around since the beginning of time, or whenever, I don't know.
Right.
But it's been around, for a long time. There's literally never been anyone ever overdose on it. You cannot overdose. And so, but even if you don't want to endorse it in the sense of saying it's healthy, there's law enforcement against prohibition, LEAP, an organization called LEAP. One thing they said, it's so true. They said, whenever we legalized alcohol, we didn't do it because we wanted to encourage our kids to get drunk before school, or we wanted to encourage drunk driving. We got rid of alcohol prohibition because prohibition doesn't work.
Right.
So I think that when we talk about it, we need to. I mean, yes, is it how safe is it? How dangerous is it? Needs to be discussed. But what we also have to realize is this working? Is this actually working? This policy? I'm not. Your intentions are one thing. Okay, back off from that. Look at the results. And I don't see how anybody could look at you have people, marijuana is clearly helps people with seizures, cancer, again, PTSD. There's a million different I don't know a million, but there's a lot of different things it can help for. And so why we would just want to see people suffer when there's something they could get their hands on, it's just, I just don't understand it. So for me, it's a compassionate issue. It's a freedom issue. People deserve to be able to choose the medication that they best see fit.
Okay. Well, Mr. Mayor, I thank you for your time, and thank you for being brave enough to go on camera and talk with me. I appreciate it.